This conference will now be recorded.
In the previous class, we discussed about arterial disorders. Now we are going to discuss about venous disorders. So, as you know, veins collect the blood from the peripheries to the heart, deoxygenated blood. This alteration in the transport could lead to various venous disorders, likely thrombophlebitis. Phlebitis means inflammation of the vein. You know, phlebitis means inflammation of the vein. Phlebology means study of veins, and phlebectomy means removal of vein segment. So, changes in the smooth muscle and connective tissue makes them less distensible, and lower peripheral venous system, they are equipped with valves which allow the blood flow in only one direction. If these valves are incompetent, or the perforators which connect the superficial veins and deep veins are incompetent, then they result in various venous disorders, likely varicose veins and deep venous thrombosis and superficial venous triad. As you know, virtuous triad, inflammation triad, blood stasis, injury to the blood vessel wall, and hypercoagulability. These triad results in a vicious cycle, leads to the damage to the vein and corresponding setbacks. So, thrombophlebitis, we already know. Uh, Inflammation of the vein. Phlebitis means inflammation of the vein, which could be caused secondary to a thrombus or a blood clot. Suppose you are using one of the most common nitrogen clauses. We are using intravenous cannulas for administering various fluids and various drugs in the hospital system. This is one of the most common causes for causing thrombophlebitis in the post-operative scenario or in the hospital-acquired scenario. There will be inflammation and discoloration of the overlying superficial vein in which you used it for intravenous administration of various drugs. So it can be, if it is severe, it can be by inflammatory symptoms and fever. So it is one of the important causes of post-operative fever. So factors associated with its development is, you already know, the triad: stasis of the vein, damage to the vessel blood wall, and the hypercoagulability. All these come under virtuous triad. So altered coagulability could be due to various drugs which you regularly use in your day-to-day medical practice, like oral contraceptives and all. So stasis and all, it is more common in patients who are paralyzed and who are bedridden for a longer amount of time. And in case of some major surgeries like pelvic or hip surgeries, the patient is not allowed to walk, he is confined to bed, it's absolute bed rest. So this results in stasis of blood in the peripheral veins and thrombophlebitis, consequential thrombophlebitis. So the pathophysiology, it involves both thrombophlebitis. It could the thrombus could develop both in superficial and in the deep veins. If it is in superficial veins, you call it as a superficial thrombophlebitis. Deep, you call it as deep venous thrombosis, which is more dangerous as it can lead to direct communication with the IVC and all. Superficial veins, you could have conservative management. Deep venous thrombosis, you go with systemic coagulation followed by surgical management or placement of IVC filters, so that the deep venous thrombosis, which the most common veins in all are the peripheral calf veins. So these calf vein, the thrombus can progress from the thrombus into the inferior vena cava, and it could lead to various manifestations such as pulmonary thromboembolism and all. So in case of deep venous thrombosis, there is a score to predict prognosis to pulmonary thromboembolism. It's known as a Wells assessment score. So the deep veins involved are popliteal, femoral veins, and superficial is saphenous vein. because of thrombus or a clot. So this clot in the venous system, if it is superficial, generally it resolves with the conservative management. If it is deep, it could lead to propagation, could lead to severe disorders. So deep vein thrombosis generally it occurs at the bifurcation. So bifurcation is the site of turbulence in the blood flow. So major risk in case of thrombophlebitis acute phases, the thrombus or embolus could dislodge from the peripheral veins. It could travel into the systemic circulation and could and lungs and all. So pulmonary thromboembolism is the most serious progressive which threatens life in case of deep vein thrombosis. So the clinical management is generally there will be unilateral limb involvement unless it perfectly involves a bifurcation of the IVC to the iliac veins. So generally the peripheral veins are involved, so it involves one limb, will be very much swollen in size. Our overlying skin will be thickened and stretched. There will be severe pain accompanying, and the patient will be unable to move because of obstruction of venous blood flow. There will be gradual discoloration. So increased circumference of the thigh or calf. So hormone sign you should elicit in case of early DVT. So dorsiflexion of the foot, it produces pain. In case of confirmed DVT, you should not check for hormone sign or any other sign because the manner which you are eliciting hormone sign can lead to dislodgement of the clot and it could lead to pulmonary thromboembolism. There is risk of thrombus getting dislodged and entering into systemic circulation. So if superficial veins are not affected, there will be signs of inflammation like inflammatory signs, redness, warmth, tenderness. So the overlying vein will be hard like palpate in case of superficial thrombophlebitis. Uh, so this is the deep vein thrombosis. In this image, you could clearly see the superficial vein, and in the muscular plane, there will be connecting perforators which help in the blood flow from superficial to deep vein. One is a valvular system, and the other is perforator communicating system, which helps in flow of blood in one direction only. It allows blood flow from superficial to deep. So this thrombus in the deep infiltration. Here in the image, you could clearly see there is a classical involvement of unilateral limb and increased circumference of first calf and gradually thigh, depending upon the site of involvement and severity with which it occludes the venous system. So this, if it dislodges into the IVC, it could threaten to a clot in the heart. So superficial thrombophlebitis, you could manage with the conservative management like bed rest with the limbs elevated. So reducing the superficial thrombophlebitis effect, there will be application of hot fermentation, and for reducing the pain, there will be you need to administer NSAIDs. All these come under medical management. So DVT, which is a serious scenario, it requires hospitalization, bed rest with elevated 15 to 20 degrees above the heart level. Limbs should be elevated roughly about 15 to 20 degrees above the heart level to prevent its progression. So the knees should be slightly flexed and the trunk should be horizontal in position. So this position helps in promoting venous return and preventing further emboli and edema prevention. So elastic stockings to reduce the inflammation and associated edematous changes. So initially the anticoagulants you use with is IV heparin because warfarin initially in the early days of administration of warfarin you need to combine with it with heparin for anticoagulation purpose because early stages of warfarin administration it has procoagulant activity. So instead of acting as an anticoagulant, it acts as a procoagulant activity. So you need to administer it along with the heparin in the early stages, and after a few days you could switch it back to Coumadin. So to disrupt the thrombus, you could use fibrinolytics. Because of the stenosis of the vein and all, you could use vasodilators. So if it is life-threatening and severe cases of complete venous occlusion, there is surgery. And prophylactically, you could, in case of patients who are at high risk of pulmonary venous thromboembolism, you could place a vena cava filter such as the greenfield filter. The purpose of this filter is it prevents embolization into the heart and lungs. So, in case of acute system, the thrombus is already formed. The thing which you have to do is thrombectomy. So, the most common results in the peripheral are the fungal veins. So, you make a venotomy or a venotomy means you open the blood vessel, you remove the clots, and you will systemically anticoagulate everything, and then you suture it back. So, post surgery, you need to assess the characteristics of the pain, onset of the duration, history, and whether there is any color changes or temperature changes. So, increased circumference, which is a notorious sign, you need to monitor it using a tape to measure the circumference of the calf of the thigh. So, this image shows insertion of a IVC filter. The filter here used is the greenfield filter. So whenever the thrombus propagates from the peripheral towards the IVs and all, this filter it occludes the thrombus and prevents its progression to the heart and the lungs. This is the purpose of filter, and there are self-filterable filters which are now commonly used, such as the opt-ease filter. All these are trade names of particular vena cava filters. The purpose is the same, and this is a sequential compression device which helps in because of the sequential compression and increased pressure. It promotes venous return and reduces the edema and peripheral pooling of blood in the peripheral veins. So this sequential compression device more one is the stockings and the other is sequential compression device. This is costly and good to use. Using intervention frequently changes entry circumference. You need to notify it to the operating surgeon. You need to elevate the limb. So regular minimal exercise and turn off in case of severe increase in the size of the limb or edema, you need to elevate it above the heart level. Or if it is rapidly progressing, then you need to perform a fasciotomy or other surgery to release the edema. So crossing of the legs at the knees and this should be avoided. Post surgery, you should not use tight bands around the operated part. So, so you need to explain to the patient about the purpose of bed rest and leg elevation, usage of elastic things, and you need to monitor for any other aggravating symptoms such as sudden increase of onset of chest pain dyspnea means these are the signs of pulmonary thromboembolism, which is grievous. You need to monitor for these signs in case of severe pulmonary thromboembolism. So, in case of incision site bleeding, hematoma, or any increase in change in the color of the lymph or pressure of the site, so absolute bed rest for the first 24 hours, and then encourage exercises to promote venous resistance. Elastic bandage should be applied, not a constricting bandage. Elastic crib bandages are different. So you should not massage the extremity in case of DVT, as it promotes further clot formation and clot dislodgement or anything. So depending upon the need of the patient, you could provide him the necessary anticoagulation. So chronic venous insufficiency. Main chronic venous insufficiency means obstruction of the venous walls, and there is venous reflex. Instead of venous return towards the heart, there will be reflex towards the peripheral vessels. So this results in peripheral pooling and gradual accumulation of blood, and the hemocyte pigment accumulated alongside can lead to discoloration, and there is venous ulceration. And the pharmacological therapy is antibiotics for infection. So the topical therapy can be used for cleansing and debridement. So this is the typical picture of venous ulcer. So the common site involved is the genital region or above the medial malleolus. So commonly overlays the main perforator, the line of perforators from superficial to deep veins. The entire line is known as the Linton's line of perforator. So as you could notice, the venous ulceration here, floor of the ulcer is occupied with pale granulation tissue. Edges are a sloping type, which means it's in healing phase. Pale granulation tissue owing to the poor amount of circulation, and surrounding skin changes, like you could clearly notice here pigmentation and thickening sclerosis of the skin. So all these components are seen in venous ulceration secondary to chronic venous insufficiency. One of the most important factors which you need to know in case of pathophysiology of the chronic venous insufficiency is ambulatory venous hypertension. So normally when you ambulate, there will be decrease in the pressure of the peripheral veins. So the paradox here is ambulatory venous hypertension. Instead of decreasing pressure, the ambulatory venous hypertension means is promoting increasing the peripheral pressure. The next thing is varicose veins. Abnormally dilated and tortuous veins are known as varicose veins. So how much dilatation? Greater than 3 mm, you call it as varicose vein. Between 1 to 3 veins, you call it as a reticular veins or the spider veins and all. Less than that, less than 1 mm, it is telangiectasia. Hey. So the congenital causes include absence of wall or incompetent valves. So prevention means usage of elastic grip bandages or venous stockings. So moderate exercise and elevation of the limbs above the level of heart. The exercise help in improving the peripheral venous circulation and improved venous return. So this is the normal. On the left side, you could clearly see the normal direction of the venous flow from peripheral to the IVC and to the heart, collecting the deoxygenated. So these valves which promote unidirectional flow. Suppose if these valves are incompetent, this unidirectional flow can get damaged. So incompetent valve or congenital absence of valves, all these could lead to varicose veins. So on the right side, you could see clear, abnormally dilated and tortuous vessels, which is varicose vein. So you clearly notice the skin bulging outside the consent segment of varicose veins. So this is the deformed wall. And you could clearly appreciate instead of unidirectional flow, there is reflex. So traveling upwards towards the inferior vena, it is also traveling in the reverse direction. This is known as the reflex. So the termination point of Stephanus vein is into the at the level of sternofemoral junction into the femoral vein, so piercing the cribriform fascia and all. So these things they lead to obstruction at the level could lead to sternofemoral reflex. So pathophysiology. These valves typically they are directed upwards. They help in unidirectional flow. They prevent blood from reflexing back into the peripheral veins. So the great and the superficial veins are the most commonly involved. Suppose these valves close, promoting only unidirectional flow. So gravity helps in peripheral cooling, and blood pressure helps in returning blood from the peripheral veins to the central venous system, IVC, and then to heart. So one of the important mechanisms you should use is calf contraction. So the calf muscles, gastrocnemius and soleus together are known as the peripheral heart, which upon contraction help aids in the propulsion of venous circulation from the periphery to the center. So the primary manifestations include you could clearly notice outside superficial veins which are dilated and tortuous, and signs and symptoms include dull, aching pain and case of prolonged standing. So the patient typically complains of pain at the end of the day after completing pain. So as these are commonly seen in case of rickshaw pullers and people who are involved whose work involves prolonged standing. So there is heaviness and fatigue because of reduced blood flow to the tissues. So secondary varicosities, they affect the deep veins due to chronic venous insufficiency or thrombosis. So ambulatory phlebectomy means clearly on the left side of the image you could clearly appreciate the venous segment which is dilated and tortuous. So before surgery, the ambulatory phlebectomy means you make a small incision overlying the vein. You pull out you open the deep fascia and you open the superficial fascia and you took out the vein outside. You disconnect the both sides of the segment and remove a bit of the vein So post-operatively, this is the image, corresponding image. So one is a Trendelenburg test to assess the competency of venous valves. The test is known as the Brody and Trendelenburg test. It has two components. So it assesses the competency of the sternofemoral junction. So first the patient lies down with the fetal leg rising to empty the lobe for venous emptying, and then the tourniquet is applied from below upwards, and then the patient stands. So the direction and filling time are noted. So if there is rapid filling back, it means incompetent valves. So there are two components of Brody and test. So surgical intervention in case of varicose veins is One is a long-lasting surgery known as the frontal surgery, which was modified by the systems of Perthes modification of the frontal surgery. So it involves an incision in the groin, roughly 4 to 5 centimeters of incision below the inguinal ligament, uh, below the groin crease, 2 to 3 finger below the groin crease, from the adductor magnus to the circumfemoral opening. So, femoral canal, you could identify the femoral vein artery based upon the femoral passages. It lies in van in the neck, vein artery nerve in the femoral canal. So, you need to mark an incision, you need to open, and first you ligate the tributary, 3 tributaries, and the next is you ligate 3 tributaries, supraflex iliac, superficial pudendal and all. Superficial epigastric, circumflex pudendal, and circumflex iliac, external pudendal. All these tributaries are ligated, and there will be, and you need to perform a flush ligation in the surface. What is a flush ligation means? You should not leave behind excessive segment. Flush ligation means ligation at its junction with the femoral vein. So you need to perform ligation of the surface vein at its junction with the femoral vein. So after functioning, you will perform venotomy and introduce a stripper. The stripper generally it is introduced to the level below the knee. So the stripper, if there is a severe involvement below the knee also, you could introduce and strip of the entire great spine, which is commonly involved in varicose disc. The most so why do we strip to the level of knee and not to the level of ankle? Thing involved is there will be associated damage to the sural nerve accompanying the vein. So in case so you will avoid stripping of the vein below the knee segment. So after this you will provide sterile dressings and elastic bandage, compression bandage. So this is it. The stripper in this segment it is being introduced. So in this image you could clearly see the surface vein and its associated tributaries. You will ligate it and flush ligation at its junction with the femoral vein. You need to identify the femoral junction and you will apply a suture that is known as flush ligation. So here it is known as stripper and complete stripping of the vein. This image is showing. So there are people who support both stripping from above and stripping from below. So stripper can be introduced either at the superfemoral junction and stripped above, or you could introduce a segment from below and you could strip up from above. So the nursing care is one of the most important complications for varicose vein surgery is bleeding, especially in the fourth day. So you need to look for any ecchymosis or any color changes in the operated segment. So the overlaying discoloration of the skin and color changes raised hemorrhage. So first the patient is kept flat and first few years, and then there will apply elastic rib bandage, and there will be elevation of the limb and rib bandage supporting the circulation. So supportive care includes analgesic requirement as required the patient, and you should not remove the elastic bandage or rib bandage because it helps in compression, and it also acts as a hemostatic owing to the pressure applied. Give me a moment. There is a problem here. So other newer modalities of treatment of varicose veins include, in case of spider veins and small veins, the commonly used method is sclerotherapy, and the newer technique is Tessaris method. You use a small pediatric cannula or a catheter, and you will cannulate the vein. And there are two types of sclerotherapy. One is used sclerosant, and the other is used foam sclerotherapy. This sclerotherapy helps in collapsing of the both veins and the decreasing of the size of the vein and complete closure of the vein. So the other newer modalities include laser methods such as the Trivix and the ultrasound guided method. The other is in recent days it could be done using a endoscopical method also. Method is known as SEPS, subfacial endoscopic ligation of the proper muscles. So endovenous laser ablation. So to assess the clinical impact, there are a few scoring systems known as Venous clinical severity score for the pathophysiology and the most common method of classification used is CEAP classification. C for clinical, E for radiological, A for anatomical, and P for pathological. So laser method, and there is radio frequency method. So these are the various modalities of the treatment of varicose veins. With this, I conclude my class. So the coronavirus pandemic is in its community transmission stage. I advise all of you to stay safe and stay indoors, break the chain and prevent the progression. Educate people around you also. We are living through hard times. Doctors are facing very tough times. And finally, I would like to wish all of you a very happy Doctors Day. Bye.
Thank you, sir. Same to you, sir.
Send the attendance to surgical